In the recent work of the International Commission on the Biological Effects of Electromagnetic Fields, to which I'm a special advisor, we've been focusing on a publication by Ken Karipidis and colleagues from many countries, summarizing all of the studies done to date on whether or not electromagnetic fields that come from telecommunications equipment, in particular cell phones and their transmission equipment, whether or not they may cause human cancers of a common sorts, and in particular cancers of the brain and head, which is the area that has been of most concern. We humbly submit that it's a deeply flawed systematic review by Karipidis et al. It has done a bad job of summarizing the existing studies so as to make it seem that there's not much evidence when there is evidence highly suggestive of these electromagnetic fields causing tumors. A good example would be the very bad brain tumor glioma, or its even worse form, glioblastoma, where there's evidence of increasing occurrence in several countries. Something's causing that. And the best studies that have followed people for long enough, because it takes sometimes 2 to 3 decades for cancers to develop after beginning exposure to something like electromagnetic fields from telecommunications. And when you wait long enough, you'll see the increase in cancer. But if you go in there, start the study before that, or much time has elapsed, you'll miss the whole pattern of cancer occurrence. And you'll walk away, as we think Karipidis and colleagues have done, claiming there's no evidence, when in fact there is a set of studies that are strongly suggestive that, particularly after 15 or 20 years have elapsed since cell phone use began, there are clear increases in this bad brain cancer and a tumor that causes other problems in the inner ear, acoustic neuroma. And those are serious signals from Mother Nature that we should be concerned. It has a number of really serious flaws in the way it went about summarizing the evidence. So I'll just give you a few examples so you can get the flavor. So the first thing that people do when they want to do a systematic review is they collect all the studies of relevance. And actually, these authors, Karipidis et al., did a pretty good job. They found, I think, pretty well all the studies. But then there's a really important next step where they're supposed to look at the quality of these studies according to widely accepted criteria for assessing the reliability of a study, in this case, using methods from my discipline, epidemiology. But what happened when Karipidis et al. Looked at the quality of these, we call them primary studies, means the original studies that they reviewed, they accepted studies which had already been widely criticized in peer-reviewed publications, and also by the International Agency for Research on Cancer, which published a summary of this literature in 2013 and found a number of the studies relied upon by Karipidis et al. To be deeply flawed. So one example is a set of Danish studies where they followed thousands of people who had different patterns and levels of cell phone use, and looked at their rates of cancer, which come from a national cancer registry, which in a country like Denmark, and most of Europe actually, is pretty reliable. So the problem wasn't that they didn't count the cancers fully. The problem was that they didn't use any kinds of information, detailed information on how much exposure people had. For example, these studies often used the category never used cell phone during a period, say, of the last 20 years versus ever, meaning people who used it a lot or used it a little or used it a medium amount were all lumped together. And that is a recipe for making mistakes in this kind of review of the evidence, because it basically eliminates any pattern you might see, a very valuable pattern for assessing whether or not this exposure is causing the cancers, which we call dose response, meaning where there more cancer occurring per 1,000 people at higher levels of exposure to cell phone use. And they just basically did not downgrade those studies in their quality. They included them in that means pooling their results with other studies that were of better quality. The bottom line would be that it means that they tended to find no effect, no evidence of causation where there might well have been. They didn't take seriously the findings of some studies, particularly from Sweden by Hardell et al., that show increased risks after 10 to 15 or even 20 years have passed since the beginning of cell phone use by the subjects in the study. if you're a cancer expert, you expect external sources of radiation like this to cause cancer that takes 2 or even 3 or maybe even more decades to appear clinically, to come for patients to come with symptoms because their cancer has reached that stage. So failure to look during that time window, that's the relevant time window, carefully at the evidence, means that they were, we have an old saying in my field, epidemiology, which is they were looking under the lamplight for their car keys, not because they lost them there, but because the light was better, meaning they chose to do the convenient thing, to look in great detail at the studies of much shorter duration, covering a much shorter period after cell phone exposure began. My advice to you is to be wary of reassurances about hazards in the environment for which we could not possibly be sure of safety. This is an example of one. There are others, such as forever chemicals that stay in the environment a long time. And in particular, if the concern is cancer, then one should be very cautious about saying there's no significant risk to the public until some decades have gone by. We humbly submit that the public needs to understand what is good science and what is not good science in this field in order not to be misled. Thanks very much.